the limit. It forces educators to work with the medical community. It forces ophthalmologists to talk to teachers. It truly is the intersection of health, education.
I guess again we lost the volume. Dr. Savita, are you there?
Yes.
We cannot hear the audio at all. So I would request you to please restart the session again, restart the recording again.
Fine.
CVI, presented by some of the leading specialists in the field of CVI in India and some international guests as well. And the topics range from the more medical aspects of CVI to interventions and some educational supports. Before I get into the meat of what I'll talk about today, I wanted to give a quick shout out to Dr. Shroff's Charity Eye Hospital. As I mentioned before, CVI is a challenging and complex thing to take on as an eye hospital. Dr. Suma Ganesh and her team chose to take on that challenge many years ago and to see these children, to diagnose them correctly, and to provide the interventions and supports that those children need. Perkins is so pleased to be able to partner with Dr. Shroff's hospital to create even broader programs for the early identification, intervention, and educational supports of children with CVI, and also supporting children with vision impairment and other disabilities. When I think about CVI, I often think in terms of the following two slides. If you have met one child with CVI, you have met one child with CVI. And that really sums up a lot of the complexities of CVI, in that every child is unique and sees in unique ways and has a unique way of learning. I've been working with children who have CVI for over 20 years, and I've yet to meet two children that present exactly the same and who learn in exactly the same ways through their vision. So if you remember nothing else from this presentation, please keep that in mind, that each child is very, very unique. I will leave the heavy lifting to my colleagues to talk about the intricacies of CVI and some of the more detailed aspects. However, I would just like to cover just a few foundational pieces to set the stage. You'll see CVI mentioned as cortical vision impairment and cerebral vision impairment. I won't get into the controversy, but it means the same thing. It just depends on the school of thinking and some of the history behind CVI. So both terms are used interchangeably, and it's easiest to call it CVI. As many of us know, it's a brain-based vision impairment. And when we see these children, many of them have healthy eyes, that the damage really is in the visual pathways and the areas of the brain that control vision. This affects their visual attention and recognition and causes them to have unique visual behaviors that aren't attributed to their eye function. CVI right now is the leading cause of vision impairment in the United States. The hopeful message here is that effective treatment can lead to improvement in vision in these children. In preparation for talking with all of you today, I thought about the intersection of health, education, and neuroscience, and thought that there's no better perspective than that of a family member of a child who has CVI. So I went to my colleague at Perkins, Rachel Bennett. She's a mom of a child who has CVI, and she's also a professional in the field. And I asked her if she had a few minutes to talk to the leading ophthalmologist in India, what would she say? What would she share with them? What is the most important thing for people to know? So my next three slides focus on essentially what she told me to tell you, to share with all of you. So the first is really the importance of early diagnosis. Too few doctors understand CVI, so it is often well underdiagnosed. Ophthalmologists are the gateway to information and to sharing information with families. Families, when they don't see their children seeing the right way, will come to an eye hospital, to an eye clinic, to the eye doctor. So often ophthalmologists are the first professional that the family is coming into contact with, and therefore are the gateway to getting the family further supports for their child. We hope to change the way we do clinical assessment, to go beyond the teller acuity cards, to go beyond a traditional clinical assessment, to look at more functional aspects of vision so that we can diagnose more readily. To ask the questions, are we capturing changes in visual behavior? Are we collecting the information and history from families that are often the clues that lead us to diagnosing a child with CVI? And eventually, can we change the definition of what vision impairment really is to include aspects of cortical vision impairment? Rachel also pointed out the importance of early intervention and really taking advantage of those early years where neuroplasticity comes in, and where children's brains are so placid and able to make those new connections that can actually help them to learn. We need to know and use the assessment tools that are out there to diagnose and to provide interventions for children. And we need to develop more tools. There's a great need for more and more complex assessments for CVI. We also need to develop the interventions to support progress. Many of them are out there, but there needs to be further dissemination of these interventions across a variety of communities, in eye hospitals and education settings, in order to give the children the access to that early incidental learning that is their foundation for all the concepts and learning that they will use to grow and to thrive. And finally, the importance of education and social inclusion. We need additional education approaches that are really based on the neuroplasticity research, and therefore the connection between the research and the practice. How can we give children with CVI better access to learning by using strategies that help them to see and therefore be able to take that information in and learn so that they can meet their greatest potential? And how can we share all of the tools that we have in our toolbox with each other so that we can develop further programs and better programs for children with CVI? What does the future hold? So there's been so much progress made in the area of CVI over the past 20 years, but there's still a lot of work to be done. There is a lack of widespread information on CVI. You'll find in communities where there's a knowledge, where people understand CVI and can assess, there are diagnoses of children with CVI, and in other communities, there are none. We need more research and information sharing among the global community of eye care professionals and educators. We need more collaboration between ophthalmologists, research, and educators to provide the full spectrum of services that children with CVI need. And we need increased recognition of CVI in the eye care community as a whole. Perkins School for the Blind has been working with children for CVI for several decades and has become known as a center of excellence in CVI diagnosis and intervention. However, in the past year, we have made a further commitment to play a significant role in the spread of information of CVI and support to families and children in the US and across the globe. Perkins has committed to building a Perkins School for the Blind CVI Center. And it's in progress right now. Some of the pieces are rolling out as we speak and in the past few months. One of the aspects of the center will be essentially a learning lab. As we are already working on clinical assessments, diagnoses, and intervention of children, it will be a place where more children can come for those services. But beyond that, the professionals who serve them will also be able to come to be able to work alongside the ophthalmologists, the educators, the therapists, to learn so that they can bring that knowledge and skill to their community. There's a focus on integrated assessment. Again, talking about going beyond the clinical assessments and really looking at functional assessments, looking at how children, not only how are they seeing, how are they learning, and how can they better use their vision to learn. There'll be additional e-learning opportunities, although I will point out, please, to check out the Perkins.org website, as there are many e-learning opportunities already there. Some are accredited courses, some are quick, short courses, but there are several for you to take advantage of. The advocacy and collaboration is a big part of the new CVI Center. And as you'll see on the screen, CVI Now is a portal right now for parents. And it has information about CVI. It has wonderful information. I go there often myself to look at the latest research, to learn about new strategies, what are families saying. So I encourage you, as well as professionals, to use this as a resource for CVI. The idea is the more that families and professionals know about CVI, the more that they can advocate for their children to get the services that they need, and that will pave the way for children in the future. The goal of the center is over the next 3 years to reach 50,000 children who have CVI in the US. But the other goal is also to reach children beyond those children in the US and to influence the international community, the global community, and bringing research and practice together. So please visit the CVI Now website, check out the resources there. I wanted to thank you so much again for being with me and for being with the whole team of us here today to provide additional information on CVI. Please reach out if you have any questions or ideas or thoughts. I would be more than happy to meet you and to discuss further. Thanks so much. Enjoy the conference.